Okay, so we're talking about the good, the bad, and the lies of cholesterol tonight. How's that?
Okay.
Okay, so let's do some true and false, okay? Cholesterol is dangerous for you, leading to heart attacks and strokes.
False.
False, right. You can't live without cholesterol, and we'll go over that tonight. We get the majority of our cholesterol from the food we eat.
False.
False. False, absolutely. 85% of it comes from your body, okay? People with aggressive and violent personalities, people prone to suicide, people with poor self-control, and criminals have all been found to have high cholesterol.
I've not heard that one, but I wouldn't believe it.
No, they have low cholesterol, too low. Isn't that interesting? And everybody's cholesterol level should be the same. According to the Medical Association, yes, but false, no. All right, so heart disease is epidemic. This is from Dr. Michael Gaeta. The WHO is World Health Organization, estimates 12 million deaths per year worldwide due to cardio events, 10 million Americans diagnosed with coronary heart disease, 8.5 million suffer from heart attacks, 74.5 million suffer from hypertension. Cardiovascular disease is an unnecessary and preventable lifestyle condition, not a cardiovascular drug deficiency. And we're going to talk about that tonight. All right, money, 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 money. Statin drug sales in America are at about $37.8 billion annual. Do you think they want you getting better? They don't want to. They do not want you managing your cholesterol on your own. They want you to use drugs because it is a big, big industry. Lots of money there. So the drug industry created and controls the U.S. government's National Cholesterol Education Program, NCEP is what it's called, which published guidelines that recommend statins for 40 million Americans. All right? There was heated controversy in the medical community over the fact that 8 to 9 of the experts on this panel had financial ties to the drug industry. And this was cited by Business Week magazine. Ooh. Interesting, huh? All right, so what's cholesterol? So when we go to the medical dictionary, we have a definite definition of it. A steroid alcohol, and that's its number, that is present in animal cells and body fluids, right? And it regulates membrane fluidity. It's a precursor to metabolic pathways. It's a constituent of LDL cholesterol, and it is the big thing for your steroid hormones. So when we look at these steroid hormones, we're looking at big ones: cortisol, estrogens, testosterone. It is the foundation of your big, big hormones. Did you know that? No, they don't tell you that part, do they? Yeah. So this I love. It's the nails of a house. So what he says here, cholesterol acts to interlock lipid molecules which stabilize cell membranes. Cholesterol is a vital building block for all bodily tissues. Lowering such a vital molecule is absurd. To illustrate, imagine that your house represents your body and the nails holding it together, cholesterol. Now start pulling each and every nail out of your house. And what happens? It turns into a pile of rubble. And the same is true for the human body. So did you know that? Yeah, interesting, huh? So where did this fear of cholesterol come from? Because, man, have you worried about cholesterol?
Because your doctor tells you.
Because your doctor tells you, and it's on TV, all the commercials, and every time you open a magazine, they have all the advertisements. Lower your cholesterol, it causes heart attacks. Well, if we come back here, in that definition, you see that red may cause atherosclerosis. They've never been able to prove that cholesterol causes plaque. Never. Not interesting? Okay, so in 1960, they had a flawed study of men, not women, just men only, who ate a lot of meat and dairy and had increased levels of cholesterol. And they said that they took the fat and said, okay, it's the fat in these foods, so we need to take the fat out because that's what's causing this high cholesterol. So let's take the fat out. And their belief is that if we took all the fat out of the food, then the heart disease would go down and cholesterol levels will go down. So since 1960, what has gone up? Heart disease has gone through the roof, right? Diabetes went through the roof. High blood pressure went through the roof. But what also happened is that they found out, hey, this is a great place to make some money, right? Because it started the low-fat, fat-free craze. Remember that back in the 80s? Everybody ate turkey bacon and ground turkey. I was a personal chef at that time. You wouldn't believe the number of people that ordered ground turkey burgers and turkey spaghetti. And I can't touch ground turkey to this day. It just makes me sick because I cooked with it so much. I just can't stand it. So they thought that if we take all the fat out of our food, that you're going to get healthy. And they said, oh, and while we're at it, let's start a multi-billion-dollar business by putting in some cholesterol-lowering drugs, and everybody's going to get better. But it didn't. Heart disease went through the roof, obesity went through the roof, and diabetes went through the roof because fat is what your body needs. Lipids is what they're called, to make cholesterol, to keep your body out of inflammation, right? Inflammatory response. And that's what a heart attack or high cholesterol is inflammation. All right, so let's take a look at what cholesterol looks like. So here's one cell. They still can't give us a true count on how many cells are in the body. We're in the billions now. Okay, so this is one of those billion cells, right? So you see this little blue outer lining here? That's the outer cell wall, okay? So now, here's why this guy's out, right? You guys are all asking me, what's this toy for? Okay, so now, this is your cell wall, right? It's very fluid, okay? And so what they've done here is taken your cell wall and spliced it so that you can see the inside of what that cell wall looks like. So if you notice, you're seeing lipids, right? And that gold is your cholesterol. So, do you notice that cholesterol is kind of in there a lot on this outer cell wall? Yeah, it is, a lot. Whoops. So when we go here, this is another format. Do you see all these little stair-step lines? That's cholesterol, right? Now, what happens if we take those out? What happens to the cell wall? It collapses, absolutely. And then all of a sudden we get what's called and if I can make this happen, you get a permeable cell wall, right? And this allows toxins to get into the body, which creates disease processes, right? All right. So, do we want to get rid of cholesterol in the body? Absolutely not. That's the last thing we need to be doing is lowering cholesterol in the body. All right, so over here's another way to take a look at it. So here's your cell wall. These lines in through here, right? And then your cholesterol is these little guys down here, what's holding it up, right? So if I were to take the cholesterol out, we now have a collapsed cell lining, and there's nothing to hold it together, and it starts falling apart. We cannot lose cholesterol out of our cell walls because it's vital to the integrity of holding the cells together. So let's get an example going. Cells become tissues, and tissues become organs. Let's use your liver as an example, right? How big your liver is, takes up the nice right half of your body. So how many cells are sitting in that liver? What happens if your liver the cells start collapsing on each other? You get a diseased liver, right? Liver disease. So we can't let our cells collapse. We have to have healthy cells with healthy amounts of cholesterol in them to keep the body healthy. Does that make sense? Are they telling you this? No. Okay, so what makes it? What makes cholesterol in the body? The carbohydrates, fats, and proteins that are in your diet get converted to carbon in the liver, and your liver turns it into cholesterol. Your liver is your biggest manufacturer of cholesterol in the human body. 85% of it is made by you in your body, and the majority of it in your liver. So when they tell you, oh, you need to eat low cholesterol or cholesterol-free foods, is that accurate? No, you're not ingesting it through the food. It's conversions into carbon that are done in the liver is where you're getting it from. Now, am I saying that no food causes cholesterol issues? No. McDonald's, Wendy's, pizzas, Pops, right? That messes with your cholesterol levels, and we'll learn about that in a little bit, right? But the majority of your foods convert into carbon, which gets converted from there. So the liver makes 3/4 of the body's cholesterol. The liver regulates the level of blood cholesterol, and the liver uses cholesterol to make bile for the gallbladder. Really important, because that's how you break down your fats. And without bile, we would not be able to absorb fats and the fat-soluble vitamins A, D, E, and K. Not lacking in importance there, right? Good old vitamin D alone. It's huge. So the organ that holds the most cholesterol is your brain. Did you know that? Yeah. It consists of 25% cholesterol. But do we know that? No.
So what happens if you have your gallbladder out?
Exactly. You don't want it out, and I have mine out.
Yeah.
Mine's gone. So I have to take a supplement that replicates what the gallbladder does every time I eat, so that I am breaking down my fats properly. There's something, it's a bile salt. So I'm on it for the rest of my life. But the doctors don't tell you that once you lose your gallbladder to take a supplement for the rest of your life. They tell you to, what they told me, first few weeks after you have their surgery, you go ahead and have a low-fat diet. After that, you can eat whatever you want. No, you can't. I get some very sick people in. We have to fix that.
So would that also affect the cholesterol in your brain?
Exactly.
You don't have your gallbladder?
Exactly. Mm-hmm. Yes.
Makes some sense.
And we're going to get to the brain in a bit.
I have my gallbladder.
Okay. So cholesterol's function in the human body. Cholesterol makes key hormones, our sex hormones. We've talked about that. Cholesterol is a major building block of vitamin D. Vitamin D is made from the cholesterol in our skin when it's exposed to sunlight. So that's me telling you, Washingtonians, when you go outside in the sun, we get some sun exposure. That doesn't mean burn yourself to a crisp. It means get out and let the sun get on your skin. And then when it starts turning a little pink, then we get our sun protection on. But that's where your cholesterol is coming from, is getting that sun on your skin to get the vitamin. Yes, but it's cholesterol. We're getting there, doctor. So, vitamin D is made from cholesterol. We've got to get it in there. Okay. So again, I want you to start looking at how things are breaking down. If we start taking cholesterol out of our body, it stops how the gallbladder's working. It stops the way the liver's functioning, right? It stops how the body is using vitamins A, D, and K. Are we seeing this cascade? Okay. So vitamin D is used with calcium to make strong, healthy bones, right? So if you lower cholesterol, we mess up that process, right? Okay. So cholesterol provides cell-to-cell communication in healthy cells versus non-healthy cells. That's that cell wall I was telling you about. If we have good healthy cell walls, then we have good healthy communication between the cells and we're making more healthy cells. If we have poor cells, then we're making poor communication, making more unhealthy cells. Sets us up for diseases like cancer. So 25% of the body's cholesterol is in the brain, vital for memory. So cholesterol is vital for nerve function as well in the body. So here's a study, 2-year study of 1 million women. This was a big study. 1 million women was done to see if 1,000 units of calcium plus 400 units of vitamin D would decrease lipid profiles. After 2 years, the results showed decreased LDL and triglycerides and increased HDL, which is the good one, right? With a 38% increase in vitamin D levels. Now this study is only 1,000 units of calcium and 400 units of vitamin D, which in Washington we start at about 2,500 units. So that's low. So what they found is that when women went through this, their health improved drastically over that 2 years. But they didn't lower the cholesterol, right? They needed good vitamin D plus calcium, and it helped lower the bad cholesterol and upped the good cholesterol. Interesting? Okay, cholesterol in the brain. So, the most abundant materials in the brain and the rest of the nervous system are fatty substances called myelin. Okay, we've got another little visual here. So, it's 20% of myelin is cholesterol. And myelin coats every nerve cell and nerve fiber, and it also nourishes and protects all the tiny structures of the brain and the nervous system. So here's the thing. Patients who lose myelin develop multiple sclerosis, right? And 20% of myelin is cholesterol, we stated that. And if you start interfering with the body's ability to produce cholesterol, you put the structure of the brain and the rest of the nervous system under threat. So this would be a representation of myelin that's clear plastic, and here's all your nerves that are inside that it's protecting. Now imagine going in and chinking out 20% of this, and how much exposure are those nerves going to get, right? So now do you see why we start getting faulty brain signal? We're not communicating right? Right, so people who are on statins, it lowers the brain cholesterol, and they start getting some very dramatic symptoms because it's chinking away the cholesterol on the myelin. Okay? All right. So, cholesterol is critical for synapses and dendrite formation, which is the connection between the neurons. This allows you to think, learn, and create memories. So if we are not thinking well, if we have difficulty learning, and we have a hard time with memories, we start looking at how is that myelin working? How strong is the myelin in the brain? Cholesterol is an antioxidant in the brain, and higher levels of cholesterol reduce the risk of memory loss associated with Alzheimer's disease. And we're going to look at levels down a little bit further down so you can see some differences there. Reduced cholesterol is also linked to Smith-Lemmy-Optis syndrome, Huntington's disease, PMD, and Niemann-Pick type C disease. It's essential for normal brain development. Low cholesterol is linked to depression, suicide, and anxiety, and nerve damage. Okay.
You couldn't say that one word, so you had to say PMD.
I'm trying
couldn't
to.
do it either.
Well, I'm trying to make things fast for you guys, so you're not stuck here all night.
Oh,
So
all right.
I have in my notes. I have everything clipped.
You're good though.
Okay, so in 1834, a French chemist called cholesterol a key element for the central nervous system, and that was 1834. You guys know I always put little pieces of history into my speech, and that is something. If you can go back to 1834, and we have a scientist that's saying, look, this is not anything to mess around with, and they're saying it in 1834, and it's now 2016. The cholesterol produced in the brain is separate from the blood cholesterol, interfering with the liver's ability to produce cholesterol is a big no. Okay, and that's exactly what statin drugs do. By interfering with the liver's natural function of producing cholesterol, statin drugs can actually strip the body of much needed cholesterol and cause serious nervous system and cognitive damage. And I have personally witnessed this. I had a client decline in front of my face. Went from being a gregarious, outgoing individual to became kind of a non-responsive individual when I would sit and interview him for checkups, and then it became a shuffle with the feet with almost a drag as this person would walk, and I'm going, what is going on? And the spouse of this individual was very concerned because it's starting to look like Alzheimer's. And I was concerned because I had no idea the damaging effects of statins. I had no idea how much it would affect. I've heard causes neuro issues, but I didn't know how bad. And then we all talked and agreed that this was not anything that I could work with, and referred them out to a neurologist. And the neurologist, the first thing they did was take the person off of the statins. They came back 3 weeks later after being off the statins, and all of a sudden everything's back online, walking totally upright, communicating, no problem. And I'm going, what did the neurologist do? Because I figured a new medication was added. And the wife explained to me they took him off of statins. I had no idea, but the decline was so fast.
That's scary.
It was very scary. Very scary. Okay, so cholesterol in the immune system. Cholesterol is required by the immune system to help to protect the body from infection. So if you have low infection, low cholesterol, it opens the door for you to get more sick more frequently. So low cholesterol binds and inactivates microbes and their toxins. And it's released to the site of damage to put down a protective layer. And that's one of the things, like when you get cut, cholesterol runs in and it starts the healing process. It's laying down layers to get that healing going. Okay? So low cholesterol decreases white blood cells. Well, we need white blood cells. Those are your warriors. As soon as something foreign comes into the body, those white blood cells come out of that thymus gland, and they are ready to fight for you to get you healthy. Okay? And one of your big ones is when cancer starts forming. They come in and fight. Okay? So, low cholesterol also increases respiratory infections like pneumonia. Okay? And individuals with LDL cholesterol below 70 have 15 times the risk of developing cancer and 5 times the risk of contracting sepsis, which is blood poisoning, according to a 2007 Israeli study of 203 patients. You're opening the door to disease when you lower that cholesterol. Okay? So what makes it increase? And that's a big one. Why would cholesterol go up? Okay? Gallstones are made from cholesterol, and the reason is that you're making gallstones is it's caused by a poor functioning liver because it's secreting too much cholesterol. And then we have what we call a SAD diet, the standard American diet, that's full of processed foods, canned and packaged foods, which is what we are consuming now in the norm, but it creates inflammation. Well, we just learned that cholesterol is your healer, right? So if there's inflammation in the body, then your body is going to produce more cholesterol to go try to protect you, to keep you safe from getting sick or harmed, right? Stress is a big one. It will risk that is the number one thing that will get your cholesterol up. So when people come to me and they bring me their blood panels and they say, look, my cholesterol's up, then we start looking at lifestyle. Where's your stress at? It's through the roof. My boss this, or my job this, or my kids this, or I'm going through a divorce, or my mom suddenly died. Stress, okay? Lack of fiber-rich foods, and we talked about fiber in one of the other classes I just taught recently, and the importance of how it is a binder to toxins and creates an anti-inflammatory environment in the body. So important to make sure we have fiber. And sugar causes inflammation. So again, cholesterol is going to be released to go after any form of inflammation, even if it's caused by high sugar consumption. Grains are highly inflammatory because they convert to sugar. Lack of exercise because we need that lymphatic drainage. Okay? And then liver damage. If this is your main control tower of making cholesterol and it's damaged, cirrhosis of the liver, it used to be alcoholic cirrhosis of the liver caused by alcoholism. Now it's called non-alcoholic cirrhosis of the liver caused by eating the pro-inflammatory diet. Today's processed foods is creating liver damage. Metabolic syndrome, or syndrome X, is people who have a hormone pathways that are not working correctly. They have blood sugar management issues. They have blood pressure management issues. Diabetes is definitely part of metabolic syndrome. Okay. Obesity, obviously. Diabetes. Why diabetes? Because diabetes is chronic inflammatory response of the body. So your body's going to produce cholesterol to try to cool it down. Polycystic ovarian syndrome is another hormonal imbalance in women, producing too much testosterone, so the body's going to try to right it. Hypothyroidism. Usually anything to do with the thyroid is going to cause an inflammatory response because it leans into an autoimmune disease. And then the number one thing that I find with my clients, and they don't realize it until we start doing the research, they're on medications that cause high cholesterol. So their doctors, instead of looking at their meds and the side effects of the meds that they put them on another med to lower their cholesterol. It's like, well, could you point this out to them that maybe the side effect might be doing this and you need to change your drug? Something easy like that. Aging, and this is something that they've shown in Swedish studies and hasn't really made it over here, but in Sweden, they have cholesterol levels sitting up in 600s and 800s. And they're perfectly healthy and live long. There's different types of cholesterol. There's sticky cholesterol that causes problems, and there's light and fluffy cholesterol that is the protective cholesterol. They have the light and fluffy cholesterol. So as you age, your cholesterol should increase because we become more inflamed as we age, right? Joints get more painful, body gets more painful, so the body will naturally produce more cholesterol to help soothe the joints and the joint pain. Okay, and we talked about alcohol consumption. Then there's the hereditary factors, the hyperlipidemia. And this is one where one of my clients, they have higher than normal cholesterol, and it's a genetic defect. And her doctor told her, you're going to be on cholesterol medication for the rest of your life. And she came to me and asked me, is this true? Is there something else we can do? And one, I don't ever take people off of their medication, period. That's not my job. My job is to support them nutritionally. So I did. I supported her nutritionally. And she went and had her levels done. Well, they were too low. Yes, she dropped too low. And so the doctor's going, whoa, we need to change your med. And it kept dropping and dropping to the point where the doctor says, this is dangerous. You can't stay on this medication anymore. Okay, so she gets off the medication, and she's been off of it ever since. So in her case, even though she's genetically predispositioned for it, by changing her diet and we support her through supplements and herbs, we overrode the genetic break and we are able to keep her cholesterol within normal range without having to be on medication. Is that going to be true for everybody? I don't know, but for her, it worked. So it's pretty cool. And of course, smoking, because smoking is inflammatory, right? So here's the thing that's coming up now, and this is a big one. This is pediatric high cholesterol. And the latest trend is that they're putting kids on statins too. So now we have kids on statins in school, and this is affecting their brains, right? And just what teachers need more of, all right? So the big thing is that the doctors, when you read through the study, the doctors are not doing any lifestyle counseling to the kids, which obviously the kids are either predisposition, we've got, and there's that genetic factor, right? Or it's just their diet, that standard American diet. But they're not saying, hey kids, get out and run and play. Get off your games, get off your phones, and mom and dad, I need you to start changing up how you eat. They're starting them on the drugs that young. Okay? Not okay. They're not addressing the true underlying issue of why these kids are needing cholesterol meds. So now they're saying that kids should start having a lipid panel done by 9 years old. Crazy, isn't it? Okay, so these are, you guys see these when you get your blood test done, LDL, HDL, and triglycerides. So let's talk about what they are. Low density lipoproteins. This is, quote, bad cholesterol that circulates in your blood, and according to conventional thinking, it may build up in your arteries, forming plaque that makes your arteries narrow and less flexible. If a clot forms in one of these narrowed arteries leading to your heart or brain, a heart attack or stroke may result. So HDL is high density lipoprotein. This is the good cholesterol that helps keep cholesterol away from your arteries and removes any excess from arterial plaque, which may help in preventing heart disease. They still haven't really proved this yet. You need to know that. So triglycerides, elevated levels of this dangerous fat have been linked to heart disease and diabetes. This they're seeing, hands down, okay? But here's why. Triglyceride levels are known to rise from eating too many grains and sugars, being physically inactive, smoking cigarettes, drinking alcohol excessively, and being overweight or obese. Sounds like the standard American diet, right? So is it the triglycerides that are killing us, or is it the food that's killing us?
Food.
Yeah, it's the food, okay? So lipoproteins, and this is one that I'm starting to see roll in on some of the blood tests that are coming through, is a substance that is made up of LDL, quote, bad cholesterol, parts plus a protein, and it's a strong indicator of heart disease. This is something they're starting to use and look at, okay? This has been well established, but very few doctors are pulling this test. But this one will show heart disease, hands down, lipoprotein. So let's look at this dirty little secret. So this is by Dr. Frank Lipman. He says, what's measured on your standard cholesterol test or lipid profile tells the doc very little about the actual state of your health. There is no such thing as good or bad cholesterol, there's just cholesterol. The typical lipid profile test simply estimates how much triglyceride, HDL, and LDL are in the blood. Both HDL and LDL are lipoproteins, which are carriers of cholesterol and triglycerides. As cholesterol and fats are not water soluble and need to be transported in our bloodstream. It means you're not peeing it out, okay? The test doesn't tell us a thing about these lipoproteins' very important particle size, and we just talked about this. Is it sticky or is it light and fluffy? As in, how much of that LDL number is made up of the more benign, large particle, fluffy kind, and how much is the more troublesome, small particle or sticky kind. both of the okay stuff and the gnarly stuff get lumped in together under a big, old, non-specific LDL umbrella, making the average cholesterol test, at best, woefully inadequate and imprecise. Consequently, you may have blood teeming with the less alarming large particle LDL and still get signed up for a statin. And with the new controversial, and in my book, dangerous, wider net guidelines proposed by the American College of Cardiology and the American Heart Association, expect that to happen a lot more. The new guidelines will make an estimated additional 15 million more adults, plus a few kids, eligible to take statins in an effort to drug down their numbers, regardless of what type of LDL they have. Bad news for people, good news if you're buying drug company stock. Yeah, he's not kidding. So one of the things we look at when you get your blood test are what are the ratios, the HDL to cholesterol ratio and the triglyceride to HDL ratios. And many of the docs who are what we call east-west or functional medicine doctors are starting to look at these ratios. And that gives them more information about what's actually going on in your blood, okay? So other factors that you should be looking at is on those blood tests is your fasting insulin levels. Any meal or snack in carbohydrates like fructose and refined grains generates a rapid rise in blood glucose and then insulin to compensate for the rise in blood sugar. The insulin released from eating too much carbohydrates promotes fat accumulation and makes it more difficult for your body to shed excess weight. Excess fat, particularly around your belly, is one of the most major contributions to heart disease. So are they looking at insulin levels and blood sugar levels? Because is it actually cholesterol or is it prediabetes? So they're putting you on a statin when they should be looking at your blood glucose levels. Right? Another thing is your iron levels cause oxidative stress, which damages blood vessels, increasing your risk of heart disease. But are they pulling iron panels to see how your iron's doing? Because again, oxidative stress is going to cause inflammation, which will make more cholesterol be released to put the fire out. But it's actually because there's too much iron in the body. And then do they do a liver panel to find out what's going on? Do we have a sick liver or do we have a good functioning liver? But they're not doing that one either. Okay? So let's look at statins and what they do. Open wide. Yeah, here's your, okay, so 1 in 4 Americans over 45 are on statins. Statins cause amnesia and dementia symptoms because they strip the cholesterol off the brain. Statins increase calcified coronary plaque, they increase blood sugar, and they increase blood insulin levels, which increases the inflammation response. So are we trying to put the fire out or are we adding to it? Are we not progressing and making things worse? Yeah. So here's something that a lot of people don't know about. Are you the 1 in 100? The expert review of clinical pharmacology concluded that statin advocates used a statistical tool called a relative risk reduction, and you'll see this in articles. It's called an RRR, to amplify statins' trivial beneficial effects. If you look at absolute risk, statin drugs benefit just 1% of the population. This means that out of 100 people treated with the drugs, 1 person will have 1 less heart attack. Doesn't sound so impressive, so statin supporters use a different statistic called relative risk. Just by making the statistical sleight of hand, statins suddenly become beneficial for 30 to 50% of the population. Did you know they manipulated that? Yeah. We did in natural medicine. We knew something was going on because statin cells went through the roof. Warning, you guys know my warnings, right? If you're on a statin drug and find that your blood glucose is elevated, it's possible that what you have is just hyperglycemia, a side effect, and the result of your medication. Unfortunately, many doctors will at this point mistakenly diagnose you with type 2 diabetes and prescribe yet another drug when all you may need to do is get rid of the statin. Yikes. Okay, so this is the Monovalent Pathway, and what a lot of people don't know is what that is, and we're getting scientific here, but we're just going to chunk this down a bit. This pathway in the body manages your hormones, and if it's interfered with by statins, it messes with all your sex hormones, all the cortisone that comes out of your adrenal glands, and the dicols, which are involved in keeping the membranes inside your cells healthy. They are part of your protein metabolism, your cell vitality, and your immune system health. And it messes with all sterols, including cholesterol and vitamin D. So this is one pathway that statins go in and interfere with, but you can see that those are some big areas that they're compounding. Not okay. So CoQ10 is a big one. Statins deplete CoQ10, which is used for energy production by every cell in the entire body. It determines your quality of life. Your heart is the organ that demands the most energy, but statins wipe out the key source of your heart for your heart. So the big thing that we got to take away from this is that statin drugs don't stop heart disease, they create it by stripping that CoQ10. So any person on a statin has to be on CoQ10. They have to be. And the only way your body absorbs CoQ10 is with fat. You have to eat fat when taking CoQ10. All right, so this is a big one. Stand up for yourself. If you get a diagnosis that you have high cholesterol, the number one thing is to stand up for yourself and tell your doctor you'd like to avoid drug therapy and you'd like to manage it a little bit differently, unless you're on the high risk level. If you have people in your family that are passing at the age of 35, 45, and 55 with heart disease, guess what? We've got some problems here, and it's nothing to mess around with. So you're going to go on a statin, but you're going to be taking some good nutrients to support it, and you're going to change your diet, and you're going to exercise, and making sure that those supplements are in there replacing what the statins wipe out. We don't mess with hereditary factors like that, right? Yeah, absolutely. So if we have high risk factors, we take the drug, but we support the body naturally through good nutrition, exercise, and supplements. Otherwise, ask your doctor, what is another way we can manage this without using drugs? Okay, so let's look at your laboratory blood ranges. So in our world, we use what's called functional blood ranges, and then there's the medical world blood ranges. So on this side is our functional ranges that we use, and this is what the society uses. So as you can see, ours are different. And these are the new standards that they've been released. So as you can see, especially in this one, on the LDL, we've got 99 and they've got 70. That's low cholesterol. What have we learned tonight about having too low a cholesterol? We start getting mental issues, right? So if they're pushing for you to be here, how many people are going to be having some type of mental breakdown? Those nerves are getting stripped in the brain, right? Too low, too low. So those are our ranges on this side, that's their ranges. So here's an example. One of my, this was really timely, my client just came in today and brought me her reports. Can I have one? Sorry. So we can talk about it. So I wrote to the side these functional ranges so that you can see. so we can kind of get an idea of what's going on here. So if you look at her cholesterol total, it's flagged at 211 and it's high, right? So our range, functional range, is between 150 to 199. So she's not that far out of the ballpark. But in what came with her report from the pharmacy, or excuse me, the laboratory, is they now give statin reviews of when you should be putting your patients on statins and how much. And so with her levels right now, she is required to be on a statin according to the new levels. But if you look at our levels, she's just a few dinks up above. When you look at her triglycerides and her HDL cholesterol, you see that her HDL cholesterol for us that would be flagged for us. But for them, it's not. She's too low. HDL cholesterol is the anti-inflammatory one. So that means I need to go in and boost and get her HDLs up, and we do that through usually fish oils, right? Cod liver oil, something like that. And then when you go down and look at her LDL cholesterol, she's at 140. It's flagged. We're wanting to see less than 99. And her LDL-HDL ratio is right where we want it. So they would put her on a statin. But I sat down and talked to her and said, what's going on? Well, they've got a business that's going in the tank. She has been under huge amounts of stress. She has been put on a major dietary change with a doc that's out of this area. And when I say a major dietary change, I mean a major dietary change. So any time we go under that type of response, that means we're under a lot of stress, right? So would her cholesterol be going up about now? Yeah. And this person is over 60 years old. So she's aging, right? So would she really qualify for a statin? No. No, in our world, she wouldn't qualify for a statin. What we would do is support her nutritionally through getting in some good fats and to alter her diet a little bit more. The big thing that I'm seeing here is her liver's struggling, and it's probably because of the diet that her doctor has her on. It's probably cleaning her out too fast, which is putting a lot of stress on the liver. So I would put her on a liver cleanse to get that dumped out. And then nutritionally, the diet he has her on is a really good diet. It's just what it's doing to her, and the cleansing process is too much for her system at her age. So we just go in and support those metabolic pathways. And we go and redo her test here in a few weeks, and I have a feeling everything's going to be right where it should. But in their world, they would put her on statins. In my world, it's no, you're under a lot of stress and duress. We need to clean out your liver and get you on some good fish oils. Difference, right? Okay. So, what panels should you have done? You're not going to believe it when you see it. Boom. Okay, NMR is the one that tells us how light and fluffy the particles are. Then we have a comprehensive metabolic panel, and it just I'm not going to read all those to you, but this gives you an absolute precise idea of where it might be going wrong. So if your cholesterol levels go up, then we can go and take a look at some of these and go, well, this is what's causing it. You may have high ferritin levels because you have too much iron in your body, and all we have to do is say go donate some blood to lower your ferritin levels. Did you? And that's a natural way to reduce high blood iron, is just to donate blood. You don't have to do anything else. That makes it very easy. Or it may be that we have something going on in that liver that you didn't know about, and we have to address the liver. So that is a complete panel. We're part of a blood co-op, and Dr. Sandifer can get all those tests. This is about, if this goes through your insurance company, it's going to be between, depending on your insurance, $700 to $900 being charged to your insurance company. But for those of us that don't have insurance, that's $265 to give you a very good idea of what's going on in the body. So we can, Dr. Sandifer can order that for you. Okay, so when should you have a lipid panel done? Your doctor says go have it done. So do you just go have it done? There's some factors to look at. So cholesterol is higher in the winter than in the spring and summer. So should you have your cholesterol done in the winter? No. Cholesterol is higher during illness and injury. So if you have just had a major illness, pneumonia, a cold or flu or something like that, you don't go get your panels done. And cholesterol is higher after you've had dental work, whether you've had a cleaning, a tooth pulled, a root canal. Because why? Healing, right? Your body's trying to heal. So it's going to produce more cholesterol to try to heal the sites of injury. Yeah, trauma, right? Same with being sick. It's inflammation. The body's fighting, so it's going to produce more cholesterol. And with surgeries as well, because you're injured. It needs to heal you. And cholesterol is higher after acute emotional stressful events like sudden death, unexpected loss of job, divorce, or with people who have chronically high stress in their life, right? So think of what's on the stock market where they are, yeah, I mean, that's some stress. But there's other people that have high stress jobs. So there are times that you shouldn't be having a panel done. And to think about that, so when your doctor orders a panel, take a look and think, have I just been sick? Have I had dental work or surgery? How am I feeling and what time of year is it? If it's in the winter and you go and have it done, then tell your doc I want to have this done again in like May. And take a look at it, right? Before you put me on medication. Okay. So, how do we reduce cholesterol naturally? So, this gets long and drawn out, but the big thing that we've already talked about is we want to reduce those grains and sugars. We want a raw food diet. We want animal-based omega-3s. We want to replace harmful vegetable oils with healthy fats. We want to include fermented foods in your diet daily, and you just had some in your smoothie tonight with the kefir. We want to optimize your vitamin D levels, and like I said, here in Washington, 400 units of vitamin D is not enough at all. And here's the big thing. If your liver's not functioning right, your body won't absorb vitamin D right because it needs your gallbladder functioning right to shoot the bile to break down the fat-soluble vitamin D, right? Okay. So we have to have a healthy liver to absorb our vitamin D. We want to exercise regularly. We want to avoid smoking and drinking. We want to sleep. And I love this one. When people say, sleep well. Do you know how many people come to me for sleep issues? Yeah. So that takes assistance for some people. It's one thing to say, well, just go to bed early. There's some people that just have very disruptive sleep, and we need to work with that. Stress management, and I love this when your doctor will say, my doctor said this, well, you just need to work on your stress levels. How? Oh, well, just go exercise. Exercise is not stress relieving for me. It causes more stress because I'm having to try to shoot it in somewhere in my life. It does not decrease my stress. So for each person, it may look different. It may be going for walks. It may be journaling. It may be prayer time. It may be time with one of your family members or talking on the phone, etc. That's what do you do going down to the ocean or whatever. What do you need to do that will actually decrease your stress, okay? And this is the biggest one. And your dentist isn't kidding you. Keeping your teeth and gums healthy. The bacteria and infections that are in here travel down your throat and get deposited right into your heart. And there are people, and you've heard of them, where they just dropped dead of a heart attack. There were no signs, no symptoms. Autopsy was done. All things were of normal levels. It's bacteria in the heart. It wasn't due to cholesterol or plaque or anything else. It came directly off those teeth. So when we talk about having healthy teeth and gums, we're not kidding. It's vital, okay? So when you eat more non-vegetable carbohydrates than your body can use, the excess is converted to fat by your liver. This process occurs to help your body maintain blood sugar control, and in the short term, however, it will likely increase triglyceride concentrations, which will increase your risk of cardiovascular disease. So again, another big push to please reduce your carbohydrate intake because your triglyceride levels will go up. Okay, so what do we do on a non-drug approach? It's not about lowering cholesterol, it's about cleaning out your liver, right? We've talked about that a lot. Liver, liver, liver. The first place to get your cholesterol imbalance is through your liver, and one of the #1 things I do is through standard process, their purification program. It's for 21 days. If your cholesterol levels are still up after that, we got a problem, because that program cleans out everything, and it does a fantastic job. We may need to be taking supplements and getting that gallbladder up and running, and it may be, like I said, doing the 21-day purification program, but I've had some people go longer than 21 days. They actually did it for 2 months. Okay, so it just depends on the person. Everybody's body's different, right? You've all heard me say that. So this is just a few of the different types of supplements that I use in my practice to help people lower their cholesterol and get their body healthy. Now these are all standard process, MediHerb, and a couple of the other companies, but you can see there's vitamin E's and B's, different forms of B's, calcium and magnesium, gallbladder support in there, vitamins A's, E's, D's, B's, 6, C's, CoQ10. It's a lot of different vitamins that we can use to help a person out. Does that mean you do all those and take all those? No. No.
Good.
Yikes. Man, that's a lot of money. No.
And a lot of pills.
And a lot of pills, yeah. Why bother eating? Because you're taking pills. So, no, we don't use all those. It just depends on what the body needs at the time. And then there's lots of fantastic herbs that are out there that do a phenomenal job of lowering triglycerides, cholesterol levels, and cleaning out the liver, gallbladder, and the rest of the body. All right, so we're going to sum it all up. On this side here, these are healthy and normal cells. And over here are clumped up cells. Do you see that? Unhealthy cells. And that's where we use this guy here. So we have permeable cells that are not communicating right. They should be free-flowing. We don't want that picture, we want that picture. Okay, so we learned tonight that cholesterol is vital. It's a direct response to how your liver is functioning. It's vital for your brain and your nervous system. Dietary changes are a must. And we need to get the right blood panels done so you don't get a false diagnosis. And we want to try alternative supplements and herbs with lifestyle changes before we take a statin. It's our responsibility to take care of our bodies. You don't expect your dentist to show up 2 to 3 times a day to brush your teeth for you. And you don't expect your doctor to make your meals for you and spoon feed you, right? Your health is your responsibility. It's your doctor's responsibility to take care of emergent health issues. Right?
Yes.
All right. So, I want to thank you all for coming and learning about tonight cholesterol. If you're interested in the panel, Dr. Sandifer can help you with that. And again, if you would like to refer somebody to me, it's $50 for a new client office visit as a gift for coming to the class tonight. And if you'd like, if you have any availability, I'm more than happy to come to speak to any of your groups about any topic. Love doing the public speaking. So thank you for coming tonight. I hope you learned a lot.